There appears to be a surge in the number of kids being brought to emergency rooms with serious symptoms of COVID-19. Some are reporting the highest number of visits since the pandemic began. And in the last 2 weeks, province-wide, 89 children have been hospitalized. This comes as Quebec reinstates its mask mandate, and calls are growing louder here for Ontario to do the same.
We're seeing kids who are having high fevers. We're seeing kids where it's painful for them to breathe. We're seeing some kids that need a little bit of oxygen supplementation.
A GTA mom sharing this video of her 11-month-old son struggling to breathe. That took a trip to the ER and steroids to help her little guy on the road to recovery. Many emergency departments across the GTA are experiencing a steady flow of young children, mostly unvaccinated, with COVID-like symptoms. Dr. Steve Flendell is an ER physician working in York Region.
Schools went back to in-person, which, was sooner or later they're going to do. And then we saw a rise. And then since they dropped the mask mandates, it's really been a dramatic increase.
Sick Kids is reporting a large volume of patients with fever, cough, and vomiting. McMaster tells City News more than 1,600 children with COVID concerns made visits to their emergency department in the first 2 months of the year. And the Children's Hospital of Eastern Ontario is so overwhelmed right now, it's warning parents of heavy volumes and long wait times. ER doctor Brett Belchet says similar stories are playing out in hospitals across Toronto.
So these kids coming in, they're not necessarily needing to be admitted to hospital, but they're sick enough that their parents are saying, we got to get them checked out.
Yeah, the vast majority of the kids that are coming in are not getting admitted. A lot of them are very lethargic. They're not eating and drinking well. They're having fevers. They're out for the count for several days straight.
And Dr. Belchatz believes many of these cases are now coming from schools.
I've seen a lot of my colleagues actually picking up COVID from their children who are now picking it up in the schools. So we're seeing a lot of my colleagues that can't work now because they've picked up COVID from their own families.
The rapid spread of Omicron is putting a larger number of kids in hospital than seen with other variants. Chio telling City News 3/4 of all COVID-19 admissions have happened since December 1st, while Sick Kids and McMaster combined have admitted 448 kids between January and the end of March, with 75 or 16% ending up in the ICU.
I would say to any parent who's thinking about this is, well, the averages are in your favor. If you've got a healthy kid, averages are they're probably going to be okay. But unpredictably, we don't know which kids who are very healthy could end up with a very bad outcome.
Since last week, there has been an overall rise of about 40% in the number of hospitalizations across Ontario. The Premier telling reporters yesterday this was expected.
Our hospitals are in good shape right now. We expected a little spike. We said that over the last month. But again, that little spike, we're being able to manage it.
Is this a small spike in your opinion?
Well, it's the beginning of a wave. The tidal waves always look small at first. And then when they crash down on your head, they don't look so small anymore.
Now, both the ER doctors you just heard from, they're calling on the Ford government to bring back the mask mandate to help us get through the sixth wave and protect the children who remain unvaccinated. Now, we haven't heard from Ontario's Chief Medical Officer of Health for about a month. City News has reached out to Dr. Kieran Moore's office numerous times requesting an interview, to no avail.